Hello, my name is Daniel Rodriguez, and if you're watching this video, you want to learn more about Medicare, which is great because that's what I'm going to go over today. If you have any questions, feel free to, I'm going to put my contact information below, but feel free to contact me at any time. I'll be more than happy to answer your specific Medicare questions. Thank you. Good afternoon, everybody. Today we will be going over what Medicare is and what we like to call a Medicare 101. So we'll be getting to know the basics of Medicare, what the enrollment periods are, your options, your Part D prescription drug coverage, and when you can enroll, when it's possible for you, because there's different scenarios in here. The first thing we're going to get to know is what Medicare is. There's two components to Medicare, Medicare Part A and Part B. So if you take a look at your card, your red, white, and blue card, you'll see that there's going to say Part A, hospital, Part B, medical. And that's it. So what does that cover? Well, your Part A covers your hospital. If you were to fall and go into the hospital, that's what would kick in. Your Part B is your doctor's visits. I like to refer to it as the meat of the coverage because it's doctors, specialists, durable medical equipment such as oxygen tanks, wheelchairs, things of that nature would be your Part B going in. It's always good to know that generally it covers 80% of Medicare approved healthcare costs. And we'll get into a little bit more details about that. Here's a chart that kind of explains it a little bit better. Know that your Part A deductible is $1,556 for the year of 2022. These do change from year to year, so it's important to know what the latest information is. For Part B, the medical component of it, it is $233 for 2022. So it's good to know those two pieces of information because they will apply to you if you're on original Medicare. The Part D premium on average is about $20. I have seen them as low as $6 in some markets, and I've seen them as high as $100 in some markets. So it can fluctuate between there for your Part D coverage. Now, probably one of the biggest questions I get asked is, how much is this going to cost me? Well, most Americans don't pay anything for Part A. There is some situations where you will have to pay for Part A, but most of the cases you will not. You will, however, have to pay for Part B, which is $170.10, what it cost. Now that's for the average American. You might know some people who don't pay anything because they qualify for some special situations. You might know some people that pay more than that because they're what we call higher income earners, and the IRMA rule will apply to them, so they will pay more than the average person that is paying $170.10. So always great to speak to your local Medicare agent at Coverage to Care and understand the difference of what you will pay there, because that could impact your decision on to stay with your group insurance coverage or go with Part B in Medicare. Understand that if you do get a Part D and you're paying a monthly premium, you will still have copays. So it's not just paying the average or whatever your monthly premium is of $20. You will still have copays there. And so know that that will factor into it. So your local Medicare agent through Coverage to Care can assist you in knowing exactly what that cost will be. And it is different all across the board. And know that if you decide to get on a Medicare Advantage or a Medicare Supplement plan, two different plans there, either one, you're going to have a monthly premium, most likely if it's a Medicare Supplement, and sometimes even on the Medicare Advantage. So know that's an addition to your $170.10 that you're already paying the government for a Medicare Part B. So I always like to make that clear, so that way you can estimate your cost of what everything is going to cost for you. So it's always good to know on there. And now let's kind of get into know of what your options will be. So these are some of the questions that you should be considering when you're thinking about what options you should go with. We talked a little bit earlier about Medicare Advantage, Medicare Supplement. I always like to let my clients know, what is your premium? How much monthly premium can you afford? That might make the difference in what you actually choose and which direction you go. What services do you need? I talk to clients about that all the time, and for everyone it's different. What about doctors? What doctors do you want to see? Are they in network, out of network? Do you want a no network plan, one that doesn't matter where you go, you can see your doctor, hospital, specialist? All that will factor into it. And then travel. What is your travel like? Do you go, sometimes we have clients that go into like an HMO plan, but they travel extensively. And so it doesn't make sense. They run into a lot of problems and network issues. And so those are kind of things that we definitely want to consider, as you're talking to your local coverage to care Medicare agent, and it will factor into your decision. So now basically you have two different routes you can go. You can do Medicare Advantage, MA or MAPD on this route. You can definitely do that. And what that does, it combines your Part A that we talked about earlier, your Part B, which is your medical, and then it includes your Part D in most cases into one plan. Now, there are some that don't have the Part D, and it's still considered a Medicare Advantage plan. But for the most part, most of them include A, B, and D all in one plan. So you get one insurance carrier card, and you're able to present that when you go to the doctor's office, when you go to the hospital, when you go to the local pharmacy. That's the card you present. So that is an option that is available to you. The other option is going to be Medicare Supplement. Medicare Supplement over here, number 2, is basically you still keep your Part A and your Part B, and then you have to buy a separate Part D drug plan and your separate Medicare Supplemental insurance plan. So it's usually the most expensive route you can go, but it does offer some freedoms as well. So a lot of people do like that as well. And you can get more into detail with your coverage to care agent that speak on what makes sense. So let's dive a little bit deeper into each one of these. What is a Medicare Advantage plan? Well, so a Medicare Advantage plan is sometimes called a Part C plan. You might have heard those commercials, Joe Namath, or someone talking about them on TV. They seem to be on every other 30 seconds on commercials on CNN. But they're Medicare approved plans provided by private companies that they have to follow the rules set by Medicare. So some example of these, think of any major carrier that you've heard of. Here's some of the big ones: United Healthcare, Humana, Aetna, WellCare. There's just a whole wide range of them out there that you can choose from. And so they'll have their own Medicare Advantage plans, again, also called Part C. And it's just another way to get your coverage. They'll sometimes include your Part D for your medication. So a lot of people like them because it's kind of an all-in-one. So there are some costs associated with this as well. So it's good to know what costs. If there's a monthly premium, you want to make sure to ask what that is, in addition to your $170.10 or the cost of your monthly Part B premium. So you'll know that if you choose Medicare Advantage, you're going to have a couple of different options. One is called an HMO. Now, an HMO is a health maintenance organization. What that means is you're going to have a network of doctors, and you're going to have a primary care doctor that is in that network, and he's the one that is going to refer you out. So let's say, for example, you want to see a specialist such as an allergy doctor, and you go see your primary care doctor. He refers you out to go see that specialist or whatever it may be. Now, sometimes the average turnaround is 3 to 4 days for a referral. I've heard sometimes it takes a little bit longer. Sometimes it's a little bit faster. It's kind of all in that range of that doctor's office specifically. Some of the advantages of that is they usually have really great benefits. And so you really get a lot of bang for your buck there on an HMO plan. You'll see the highest benefits on there on an HMO plan for sure. Now, if you say, hey, Daniel, that's not for me. I don't want to be referred out. I don't want any referrals. Well, then you might be looking at a PPO option, a preferred provider organization option for you. And all these carriers will have one or two of these plans available for you. Definitely check with your coverage to care agent to see what's offered in your service area, because it does depend on where you live and what is offered there. So a PPO is simply put is no referrals. You can go in and out of network, and usually people like that because it's very flexible. And so, they'll kind of decide what they want. But you do have to pick one or the other. And so one will definitely save you a lot of money on the HMO, and it's a little bit more cost effective. And the PPO is more flexible, but it is a little bit more expensive as well, and sometimes carries a higher monthly premium. So just something to look about and factor into your decision when you're going through it. So here's the look at HMO. Got to use the doctors in network. You'll need a referral like we talked about. And on the PPO, you can use outside of the network, but often for a higher copay. So it does get a little bit more expensive. Both of these options will carry some additional benefits for you. So you might notice that that they will have emergency care if there's outside the U.S. only for emergency care. You might notice high dental benefits on there. You might notice vision and hearing, where you can get your hearing exams, hearing aids, eyewear, your eye exam. All that will usually be covered. Your Part D will sometimes and typically be included on there. And then they have something what I always like to explain to people. They have something called the annual limit, the max out of pocket. That's a very important thing to look for. So as you're going through the process, make sure you look for what's the maximum out of pocket. What that means, it'll typically be a number. It might be something like $3,400. And all that means is it's not a deductible. If you ever hit that amount in a calendar year from January 1st to December 31st, and let's say it's $3,400 by paying these copays on the Medicare Advantage plan, then the carrier, whatever insurance carrier you decided to go with, will pick up the rest thereafter at 100%. So you're done paying after that limit, whatever that limit is. On HMOs, they're typically lower. On PPOs, they're typically higher. So keep that in mind as well. That will be offered for you. But that is something that's very important. I always like to point that out because you will know that you will never spend more than that amount in a calendar year. And that's important to know for your medical cost. And then all these will have extras, something like a gym membership. They'll have over-the-counter benefits, transportation. It depends what's in your service area, so make sure you talk to your coverage care agent to see what's available so that you can compare and see if there's something that fits your needs on there. So now let's dive into Medicare supplements. So what is a Medicare supplement? Simply put, what it does is it supplements what original Medicare does not cover. So remember, it was Part A, Part B on there. That's your original Medicare, and it pays 80%. Well, that Medicare supplement, sometimes called Medigap, will come in and pay the other 20% that was not covered by original Medicare. And they're sold just like the other plans that we talked about, the Medicare Advantage plans. These are sold through private insurance companies, just like the big ones that we named earlier, United, Aetna, Humana, WellCare. They will all have Medicare supplement plans available. So you just got to find out to see what's available in your area and the cost for them as well. They do not include Part D. So you might say, Daniel, I got my Medicare supplement card. Great. Did you get your drug coverage, your Part D? Because a Medicare supplement will not come with that. You have to get that in addition. Some of the great things about it is that if you do have a Medicare supplement, you can visit a doctor who accepts Medicare. So anywhere in the United States that accepts Medicare or original Medicare, you can go see a doctor. So that really widens the net on your network. There's no referrals needed as well. So like we talked about, if you do choose a Medicare supplement, it's going to cover that gap. We talked about original Medicare here. You have that A and B. Now you're going to get that Medicare supplement. It's going to cover that extra 20% that's not covered. And then you're going to also get your Part D. So a little bit more components there. Just can't forget about that. Now, Medicare supplements are standardized. This is very good to know. Sometimes I get asked this question a lot. Well, Daniel, I've seen here that insurance carrier A is $130 and insurance carrier B is $131. Which one should I pick? They're standardized. That means that a Plan G is a Plan G. By law, they cannot cover you differently than the other one. So if you're getting one at $130 and it's cheaper than the one $131, it might make sense to go there, right? Unless you prefer a brand or insurance carrier, you have a personal preference there. I could see why someone can go, but it has to cover you the exact same way. So the only difference is the premium you are paying monthly. Again, it's identical. The one thing I will say to that, sometimes Medicare supplement companies will offer like a gym membership. And I've had a lot of clients tell me, well, that's important to me because I have a gym membership and that's $30 a month I can save. That's worth looking into if your plan has a gym membership. And sometimes it's worth that extra dollar to save $30. So just talk to your coverage to care agent. They'll be able to assist you with that and see what's available in your area and what makes sense and what doesn't make sense. Please note that there are multiple plan choices when it comes to Medicare supplement. So there's Plan A, Plan G, Plan N, Plan F. There's a couple different ones, right? But it doesn't mean that you qualify, for instance, for Plan F. You've had to turn 65 before January 1, 2020. If not, you do not qualify for it. Again, this is why a coverage to care Medicare agent will assist you in kind of weeding out what your options are, depending on your needs. Does a G make sense? Does an N make sense? And they can kind of go over all the differences there through the Medicare supplement choices and the policy benefits. Some things to note is that Medicare supplement underwriting, if you have guaranteed issue, if you are just turning 65 or becoming eligible for Medicare, say your Part B just became active, then you get guaranteed issue, no medical questions. That's what you want. Now, fully underwritten client, they want to purchase a Medicare supplement for whatever reason, right? But they don't qualify for the guaranteed issue like we talked about. They're not turning 65. Their Part B did not just get turned active. So there's going to be a list of underwriting questions on the application. No medical exam required, but there will be some underwriting questions that will determine if you get in or not with that insurance carrier. So just some things to note. Again, a coverage to care Medicare agent will help you through that process and ask the questions and kind of guide you through that so you're not doing it alone to see where you kind of fall into there. The Medicare supplement pros and cons. Big pro is that they're standardized, right? It doesn't matter what insurance carrier is. If it's a Medicare supplement Plan G, it's going to cover you the exact same way, right? There's no network, so you can have a freedom to choose any doctor. If you travel a lot, I definitely recommend this choice if you're traveling a lot. Maybe you spend 3 months in California and another 3 months in Florida with the other kid, and then maybe your home state is Texas. A Medicare supplement is a very good choice then. There's sometimes offered household discounts. So if you're on the Medicare supplement plan with this insurance carrier and you want to put your wife, usually there'll be a discount associated with that. And it's predictable annual health care costs, meaning you know exactly what you're paying for the year. If you know your monthly premium is $100 a month, you know you're paying $1,200 in your Medicare supplement plan. You know you're paying $170.10 for your Medicare Part B times 12. You know you're paying your Part D. You can calculate your cost a lot easier through a Medicare supplement plan. Cons, though, just like everything, there has to be a balance. The monthly premiums are usually increased every year. They can increase up to 2 times a year. There's no drug coverage included, so you have to go and purchase one separately. And then there's no additional benefits such as dental, vision, or hearing like you see. So sometimes that could be a con. You have to go purchase them differently. So definitely talk to your coverage to care agent about that. So now we'll talk about prescription drug coverage or Part D plans. This is what you're going to use when you need medications. So you may be wondering, what will my prescription drugs that I am taking, are they covered? What are going to be my costs associated with that? What pharmacies can I go to? Those are all very good questions. And so that's what part of what your coverage care agent will do is make sure to answer those questions for you. Just know that coverage is basically the formulary that's most commonly used for Medicare prescribed drugs. Costs, the plan's formulary may change at any time. You will receive notice, though, when necessary for those cost changes. And pharmacies, always go to whatever insurance carrier you get their website. to see what's the most up-to-date information. Your agent will help you and assist you in telling you this pharmacy is in network, this pharmacy is out of network, in case you have a personal preference on which one you want to go to. But you can also go to the plan's website or call their customer service to make sure that is available and that nothing's changed. They usually don't change throughout the year. They'll change during the open enrollment period is what I've seen happen usually. And just know that a formulary is the list of drugs covered only by that plan. So if it's not in the formulary, your medication might not be covered. There might be some exceptions there, but most likely it will not be covered. So that's important to make sure you understand what that word formulary means. Now, how it works is you have two choices. If you have on a Medicare supplement, you have to buy a standalone drug plan. You got to add it to your Medicare supplement plan. Or if you just have original Medicare and you want the drug coverage, you can buy it alone as well. In a lot of cases, in option 2 here, it's included in your Medicare Advantage plan. So you don't have to pay anything additional for it. It's already there. But you do have to purchase this in addition to your original Medicare card. So keep that in mind how it works. Now, it looks there's 4 stages to prescription drug coverage, and so the main things to know here is that if there's a deductible in your drug plan, and some have them, some don't, but if there's a deductible, you're going to pay that first. The next stage of that will be your initial coverage. This is when you're paying those co-pays. So let's just say I'm taking a medication such as, I don't know, amoxicillin, and there's no deductible for that, my plan. Then I just go right in here and pay whatever my copay. It might be $2. And so I'm paying for that medication at $2. Now, here's one I don't like to talk about with people, and that's the coverage gap, or also called the donut hole. If your medication is very expensive and you fall into the coverage gap, this is when your medication will skyrocket in pricing. So just know that if you reach this, it means that your yearly drug cost has reached $4,430, and you're paying 25% of the covered brand drug. So that can get pretty expensive. Unlike the deductible, which the standard is $480 for 2022, or your initial copay, which is usually, $2, $10, something like that. If you're in the coverage gap, you'll see that number skyrocket. And you'll stay there until you reach what they call catastrophic coverage, and your total covered out-of-pocket costs have reached $7,550. If you do reach this, you will get a price break, and you'll notice it here that you'll pay no more than $9.20 for brand name drugs, or 5% of the total cost, whichever is greater. Now, this is never fun if you fall into this coverage gap or the, donut hole. It's never fun. And so always check with your coverage to care Medicare agent to see if you will fall in this. We can help you estimate and see if you do fall in, what month you'll actually fall into it. And so you can be prepared for that. And we can definitely talk about options on those medications. So now, next steps. What do you do now? Now that you know what Part A and Part B is, learn when you can enroll. There's basically a 7-month window when you can enroll. It includes the 3 months before you turn 65, it includes the 3 months after you turn 65, and it includes your birthday month in which you turn 65. So a total of 7 months there. You can enroll into Part A and B. And so if you don't enroll when you're first eligible, just know you might have to pay a penalty in the form of a higher premium for Part B. So we don't want that. We don't like any of our clients paying a higher premium or more than they should have to be paying. So make sure that is done appropriately. Speak to your agent. We'll be more than happy to assist you when that initial enrollment begins and get you onto a plan so you do not have to pay any late penalties. How do you enroll into this? Well, if you're getting Social Security when you turn 65, you will automatically be enrolled and you will get your card about 3 months before you actually turn 65. But if you're not getting Social Security when you turn 65, you'll need to call them and contact Social Security and let them know that you want Part A and Part B. And so if you worked at the railroad, you will have to contact the Railroad Retirement Board instead of Social Security. If not, most people will contact Social Security directly. You can call them. You can go online. If without COVID, you can actually go there in person and set up an appointment. So just know you have some options there on how to do that. How do you enroll into a Medicare Advantage plan or a Part D plan? What's the same, the 7-month window, as we talked about earlier. Whenever you enroll, we can get you enrolled into one of those so that you don't pay that late penalty on there. The same thing like we talked about Part B on that late enrollment penalty. It's the same thing for Part D. There is a late enrollment penalty for that as well. And it increases each month, so that can get pretty costly. And so we try to avoid that, and we try to help you so that you don't have to pay more than you should. But this is the part that we help out to make sure that you get enrolled in a plan so you don't have to pay any penalties, and you get what kind of medical coverage you're looking for. For Medicare Supplement, if that's the route you want to go, just know Medigap has a 6-month open enrollment period. So it automatically starts when you're 65 and when you're enrolled into Medicare Part B. So here's a quick example. If you turn 65 on April 3rd, but don't join Medicare Part B until May 25th, your Medigap open enrollment period will start on June 1st. This is the first day of the month in which you are both 65 and enrolled in Part B. So during your 6-month enrollment period, you can buy any Medigap policy or Medicare supplement that is sold in your state. So it's important to know it goes by state to see what's available there. If you're on a Medicare supplement, what happens if you have health issues? Well, just know that if it's when you're just getting onto Medicare, your Part B, or you're turning 65, during that 6-month open enrollment period, you can purchase a Medicare supplement or Medigap plan, even if you have pre-existing conditions. They cannot disqualify you on there. If you have a disability or any health issues, an insurance carrier cannot refuse to sell you a plan. As long as you live in the service area and you do not delay your enrollment, they can charge you more as well for a disability or health problems. So that's why it's important to do it during that 6-month open enrollment period, because if you wait and you miss that 6-month open enrollment period, some of these will apply to you, and we don't want them to ask you questions, especially if you have health problems. They might charge you more. And if you delay that, there's no guarantee that your application will be accepted if it doesn't meet the medical underwriting requirements. Only certain limited situations apply to that. So you want to make sure you get your Medicare supplement or your Medigap done right away when you can and when you're eligible. Some of the other enrollment periods that are pretty popular that you should know is the annual enrollment period. This happens through October 15th to December 7th of every year. October 15th through to December 7th. During that time period, all people with Medicare plans can change their healthcare plans. So let's say you're with insurance carrier A for a Medicare Advantage plan, and you now think that Medicare Advantage insurance carrier B offers you something that fits your needs better. This is that time period where you can do it, and you can switch from Medicare Advantage to Medicare, a different Medicare Advantage plan, or change different plans, your drug plans or Medicare supplements. You can do any change you want to do. This is the time period to do it. And you can do that. Anybody can do that from October 15th to December 7th. Know that there's also an open enrollment period, and usually typically from January 1st through March 31st. And this is in case you switch to a Medicare Advantage plan from one to another. You can make a one-time switch back to your original Medicare Advantage plan or to a different Medicare Advantage plan. And this typically happens from January 1st to March 31st. So see if that's available. And then special enrollment periods are when you are maybe losing coverage through your employer that gives you, or maybe you moved into a new service area and no longer in this part, and that plan that you're on is not offered where you're moving to. You can make a special enrollment period, or if you qualify for low income subsidy or maybe the state Medicaid program, then you're able to do a special enrollment period. There might be some other ones for chronic conditions as well. So it's important to talk to your coverage to care agent to see what you specifically qualify for, if at all, for any of those. So now it's time for questions. Feel free you can email me at daniel@coverage2care.com. You can call me directly at 210-857-7819 as well. I'll be more than happy to answer any questions you may have directly about your specific situations. Here's my contact information if you'd like to have it. You can go to our website. We have a lot of content on our website as well. If you just want to read a little bit more on your own, feel free to do that. Again, my name was Daniel Rodriguez. I appreciate you guys taking the time and listening to this Medicare 101, and feel free to contact me. Thank you.